Hey, give thanks for life. Give thanks for life. Oh, chimney, chimney. Today my rise like the sunrise, my bright and my upright. No one can break my vibes.
Hello and welcome again to Strong and Healthy, the show that seeks to inform and to inspire, to educate, and even a little bit of entertainment. Today we're going to talk about the belly. And I have a verse of scripture I would like to use from Mark chapter 7 and verse 19. It says, because, and this is Jesus speaking, because it enters not into the heart but into the belly and goes out into the draught where it is eliminated. So the good Lord was talking about a little bit of anatomy, the mouth, the stomach, and eliminated. He skipped a few areas, and those are the areas that we're going to talk about. A little bit of anatomy for you. Some of our viewers have been asking, Doc, what's up with the beard? You know, and it's something that I do from time to time, especially if I'm working on a project and I would say, I'm not going to shave until I get this done. It goes back to when I was in college. At that time, the Surgeon General of the United States was a gentleman by the name of C. Everett Koop. He was a pediatric surgeon. And he also talks about one of my all-time favorite presidents, Abraham Lincoln. And one other thing that I noticed was that the ancient Egyptians had this beard type thing, and only the people of authority had beard, but the slaves and the workers did not have a beard. There was also a gentleman at that time in Namibia, Samuel Ujuma, Dr. Sam Ujuma, who was president of Namibia. And I noticed all these things going on, and I actually wrote an article that I submitted to Time magazine. They did not publish it, but they wrote me a very nice letter. They said this was not exactly what we were looking for, but they were very complimentary about it. So I think a beard is a very manly thing, and from time to time you've got to show that you're a man. Maybe sometimes the little children and some women feel it's a little rough, but men need to be rough sometimes. So that's my beard. We'll keep an eye on it, and you'll see what projects I'm working on. Let's talk about the abdomen and the medical conditions that we have in the abdomen. As we know, the gastrointestinal tract, which is what the Lord was alluding to, begins in the mouth, goes down through the esophagus, passes into the diaphragm where the stomach is located, right under the diaphragm here. And the main condition that we want to talk about today is about peptic ulcers. And what I have noticed in my practice here in Dominica and after the hurricane is that there's an increase in peptic ulceration. I had the privilege of working in the burn unit in New Jersey at St. Barnabas Medical Hospital, and people with major burns were brought to this unit. We had a sad case somewhere in the valley where a gentleman was burned by an exploding cylinder of some kind. And from the time you hear of somebody with a degree burn greater than 60, 70%, that person most likely is going to die unless they're in a very specialized burn unit. And in that burn unit, I remember we once had a patient who was a person on an aircraft carrier, and he got caught in that contraption that catapults the plane off the flight deck, and he lost a lot of his skin. As we would say in Dominica, it's badly pliché, and so he had to come to that burn unit, treated just like a flame burn or chemical burn, and we had to take care of him. The point I'm making is that in Dominica and in the burn units, anybody who comes in for severe burn automatically is treated for stress ulceration, because any kind of stress will lead to ulceration of the stomach. And so what I'm seeing in my practice is a dramatic increase in the number of people having stress ulcerations, people dealing with their houses completely gone, the vehicle is completely gone. I had a patient down in the southern part of the island, worked very hard overseas, built his house, had his vehicle, and the sea came in and took that away. They almost lost his life, he and his wife. His house was destroyed, and he was living with his daughter. And all he kept talking about was about his house and his car and all that he worked for. And this man never really recovered from that. Physically, he was safe, but mentally, he developed ulceration of the stomach and subsequently had a stroke, one complication after another. And we lost him because there was not intervention early enough. So anybody can have stress ulceration. When I was talking to some of our television crew here, one said, my mother has ulcers and I have ulcers, so I really want to listen to that. Well, I had the same experience. My mother had ulcerations, peptic ulcers, and I had it too, going all through the stress of medical school. And sometimes it was tough. There was a period of time in medical school where I was surviving on crackers and fish heads. I had $300 in Washington, D.C., and I was trying to make it through the semester and had to make it stretch. So I'd go to the restaurants and buy fish heads and make a broth and Kool-Aid and crackers. I did that for a while and it developed ulcers. But the problem with my mother was that as she aged, she had knee problems and she had to be taking ibuprofen for the knees, and the ibuprofen was eating up her stomach. She'd have to stop the ibuprofen, and then her knees would get worse, and she went through this vicious cycle. We're going to talk about how that cycle was broken, which is very interesting. And myself as well. Anywhere I went to, if I was going on a conference, a day trip or something, I had to make sure that I had some Rolaids or Tums or something in my pocket, because if in the middle of the conference my stomach began acting up, you know, I would be in total misery unless I could get to somewhere where I could buy this. And what I noticed after I was healed, and I'll tell you about that in a minute, that if I was going through some old clothes from way back when, I would see little scraps of Tums and Rolaids, because that was a must anywhere I was going because of that. So what are the symptoms of peptic ulcers? Okay. Well, doctors take a medical history, and that history, we're not talking about Christopher Columbus and Bala and Congaree and those things. We're talking about when the symptoms began and what made it better, what made it worse, what did you take for it, and so forth, over the counter or some bush, which is another interesting thing that I always talk about. I find that today, more people are interested in taking bush. I'm talking about lawyers, executives, and top people, you know, before they consider medical treatment. And this is a bit unfortunate because, you know, now that we have our cell phones, if we have, for example, to research something, I was driving down the road and the announcer on the radio says, give me the full name of the dice, and whoever called it in was going to get free tickets to the Calypso show. Now, I was driving, so I wasn't paying too much attention, but the other person in the car desperately wanted to call, and you know, she called and it was wrong. She was off just a little bit, and we could have pulled off on the side of the road, Googled it, and gotten the answer probably within about 30 seconds to a minute or so. Now, would it make sense, you know, we wouldn't even consider going to the library in the research section and trying to look up, you know, Dice's name. You don't do that these days. You Google, okay? And so there's no shame at all. And we've got to get with the program of using the modern technology and using trained professionals to deal with our medical conditions. Because if we don't, it's our loss. So most people with ulcers will say that the pain is worse when they don't eat. which is going to be very different when we talk about the gallbladder. And the gallbladder is located under the liver on the right side, okay? It's kind of in line with the nipple and right under the rib cage, okay? So the doctor knows exactly where to feel for the gallbladder. With somebody with gallbladder disease, the pain is worse when they eat, especially when they eat fatty foods. With ulcers, the pain is worse when they are hungry. And what happens, the stomach acids begin to eat up the stomach itself. And that is worsened by stress. So we want to find out whether there is something in the history that triggered that increased stress. And sometimes it's a family problem, it's a job problem, it's a natural disaster, or so forth. Sometimes, not always, you know, or increased demands, as in my case in school, and so forth. But it tends to be, as we just demonstrated with me, the lady saying, me too, as far as that is concerned. So the doctors, even without running tests, are going to have a very good idea of what the problem is beforehand. So there we have peptic ulceration. The best test for peptic ulcers is a test called an upper GI series, where you go to in the x-ray department, they give you this white stuff to drink. They say it's milkshake. It's not exactly tasting like milkshake, let me tell you, because I had it done. And they take an x-ray and they watch as the barium meal goes down through the esophagus, and they can see whether any of it is refluxing back into the esophagus. That gives them a sort of heartburn. And heartburn is very important because the heart is over here, and all these things are in the general area. So a lot of times people have heart attacks that are evolving, and they're thinking it's heartburn, and really heartburn has nothing to do with the heart. It's stomach acid refluxing back into the esophagus and causing that kind of discomfort. So the upper GI series, a barium swallow, barium meal, will give us, it shows a very good outline of the stomach, and the radiologist can see where the stomach lining has been eaten up or rugged, or certain spasms in the stomach, or scarring in the duodenum, which is the place where the food exits the stomach into the intestine. Once you've been diagnosed with peptic ulcer disease, then the treatment is antacid therapy and drugs like ranitidine and omeprazole and the like. But most importantly is that all people with stomach problems like this should have a test called H. pylori, which is a bacteria that lives in the stomach. At first, the Australian scientists and doctors who discovered it and subsequently got the Nobel Prize for that, they were laughed out of the conference rooms of the world, because people said, man, how can bacteria live in the stomach? Stomach acid is so powerful. And I wrote in my book, Manifest Miracle, about in colonial America, a man rested his musket on a tree, and it fell, and somehow it blew a hole through his stomach. And miraculously he survived, even without, you know, the kind of medical care we had today. But it healed in such a way that there was an opening in his stomach. And this doctor who took care of him would tie meat on a string and drop it into his stomach and watch the stomach acid dissolve that meat. And he did a lot of studies on this one patient, and this doctor became very, very famous because of his studies on this patient. And incidentally, the patient outlived the doctor. But a lot of our understanding about gastric physiology and stomach acids and so forth comes from that unfortunate case back in colonial America. So H. pylori, there's a bacteria that causes ulcers. Once you have that diagnosed, then we give you something called triple antibiotic therapy. Triple antibiotic therapy. So there are lots of people who've been suffering with stomach ulcers for years, like my mother, like myself. And once we got this triple antibiotic therapy, the ulcers were gone, miraculously gone, never again. to be suffering from stomach ulcers. So I just want to say that, you know, this is, once you have this understanding, you should always ask your doctor, and different kinds of gastritis, let's look into it. We'll be right back.
Hey, give thanks for life. Give thanks for life. Oh, chimney, chimney. Today my rise like the sunrise, my bright and my upright. No one can break my vibes.
I love listening to Strong and Healthy with Dr. Sam. I really learn a lot.
Sweet talk, dear man, have a lot of that. Yes, I. You don't know it's your boy Trilogy, urging everybody, young and old, to stay strong and stay healthy. You don't know we're doing it for 2018. Boom.
Disease after we talked about peptic ulcer disease. And as I said, the gallbladder is located in line with the nipple on the right side, right under the rib cage. Now, gallbladder disease is most frequently occurs in what we call the 5 Fs. Okay? 5 Fs. Okay? No disrespect. No disrespect. First F. Or is it 4 Fs? First F is fat, okay? I'm ahead of myself. Fat. Most people with gallbladder disease tend to have a little excess weight. Female, okay? Most people with gallbladder disease tend to be female, but anybody can get it. And fertile is number 3, okay? So that's fat, female, fertile, and 30, or some say 50, okay, which would be a truer F, okay? So if you fall into that category and you have pain on the right side, presto, doctor knows that is most commonly gallbladder disease, okay? And what happens sometimes, a lot of women would have gallbladder disease after pregnancy. When people are losing weight, when people are losing a fair amount of weight, there is an increased incidence of gallbladder disease as well. Okay? So in order to minimize the risk of gallbladder disease, we want to try to keep our weight under control. Nothing we can do about female. We want the females around, thank God. And fertile, we want the females to be fertile, to bring new warriors and new souls into the world. And 30, it's just a time in life when there's an increased risk of gallbladder disease. And as we said before, if someone has pain that is made worse by eating especially fatty foods, fried chicken and the like, a lot of butter, cheese, you name it, ice cream sometimes, they tend to begin to avoid those foods even without having the medical knowledge. And then life gets pretty boring for them in terms of eating, because they might go to a lovely dinner like they might have at Easter, Christmas, or Valentine's. I hope you did. And they said, sorry, I can't. Chocolate, no, I can't, because, it hurts. Once the doctor suspects gallbladder disease, then he will order and she will order an ultrasound. And the ultrasound will show some kind of gallstones in there. Okay. Now we don't remove the stones; we remove the gallbladder. It's an organ that we can dispense with. One of the tests that the doctors will order is an amylase, and that's an enzyme which is produced by the pancreas. The stones in the gallbladder can escape and go down that same tube called the common bile duct, and if it blocks the passage that leads to the pancreas, then you also have an associated pancreatitis, which is extremely painful, and it blocks the passage of the bile out into the bowel, and that bile backs up into the bloodstream, and the person becomes yellow. Their eyes become yellow, their mucous membranes become yellow, and this makes it a much more complicated problem. And that is why at some point in time when the gallbladder is diseased, we need to have it out, and it's called a cholecystectomy. Now, I have what is called a virgin abdomen. I'm a virgin, and hopefully so are you. What we mean by that is that I have no surgical scars on my belly for now. And by the grace of God, I might live the rest of my life and not having surgery. But if I have to save my life and to have a better quality of life, I absolutely will. As medical students, one of the things that we learned was the different kinds of surgical scars. And I can tell you that I was in the movie theater and there was a love scene going on. And there's this lovely actress doing her thing. And you know what I saw? I wasn't looking at the other parts. I saw an appendectomy scar right here. Right here. Wonderful, beautiful, erotic scene, I must say. But I noticed the appendectomy scar because this is something that we learned. She did not have a virgin abdomen. She had a surgical scar. Okay, so we know where the surgical scars are. If we saw a scar up here, we knew that person probably had operation on their stomach or something. The old-fashioned gallbladder scar was on the right upper quadrant part of the stomach, and the stomach is divided into four. Of course, you've got the right side and you've got the left side. And the belly button here, the navel or the umbilicus to be more precise, anything above that is the upper part and everything below that is the lower part. And most of the action in the stomach is taking part in the right upper quadrant and the right lower quadrant. So we talked about peptic ulcer. It's kind of in the upper part of the stomach, maybe a little to the left because that's where the stomach resides, where we call this area epigastric, the upper part of the stomach. A lot of people with epigastric pain, a lot of action. We don't know whether it's gallbladder, whether it's peptic ulcer, whether it's a heart condition or something. But when it's the right lower quadrant, it almost always is appendicitis. So with appendicitis, that is a very serious problem. We're going to talk about that in a little bit, but we want to make a special exception for the pelvis. And the pelvis is that part of the stomach which is below the hip level. It's just a small area from the pubic area to the level of the hip. And in females, we have the uterus, the ovaries, and the tubes, and the cervix coming up in here. Okay? And any doctor is going to be very well aware of the kinds of conditions that can cause generalized abdominal pain that starts from the pelvis. So in females, we have to be a lot more astute as to what is going on. For instance, you could have a pregnancy occurring in the tubes, what we call an ectopic pregnancy, and this is a medical emergency. Okay, and a lot of people get a little uncomfortable when doctors ask them about their sexual habits or their periods or what have you. Doctors are not really interested in your life. They have their own life to live. But this is critical, because if you're talking to a young lady or any woman within childbearing age who had recent sexual activity and may have missed a period, because sometimes period is late and so forth, and in some people, especially people with something called polycystic ovarian syndrome, PCOS, people have a history of irregular periods. They may not see their periods for 2, 3, 4 months, and that is normal for them. So if one of those people have an ectopic pregnancy, then they really don't know that they are pregnant sometimes. The signs of pregnancy, of the nausea, morning sickness, and so forth, it doesn't occur in everybody. And so if somebody also had a history of previous sexually transmitted disease, so we have to ask those questions, okay? If they have previous sexually transmitted disease and they've had a missed period and they now have this stomach pain, first thing we want to do is to find out whether this person has a pregnancy test. Sometimes people get offended, but we have to do a pregnancy test to make sure, especially if we're going to do some x-rays, we want to know whether the patient is pregnant or not. Of course, the test that we're going to do in most of those cases is a pelvic ultrasound. that can see in there what the problem is. If somebody has an ectopic pregnancy, we are talking about minutes to hours is the amount of time that we have, because this patient might bleed to death before your very eyes, especially if that pain is very sudden. Okay, also somebody might have an ovarian cyst, which is relatively benign, but if that cyst is growing in size and it pops, they can have pain, if it's on the right side, that is sometimes very similar to appendicitis pain. We talked about sexually transmitted disease. There's a condition called pelvic inflammatory disease, where we have a vaginitis that has gone up into the uterus and is spilling out through the fallopian tubes and causing pus in the belly. And this is extremely painful. When the doctor does a pelvic examination and they just touch the cervix, the patient will jump in pain. We call it the chandelier sign, because the patient will reach like they're reaching for the chandelier. That is how very painful it is. And so the doctor will document that they did a pelvic examination and the cervix was non-tender. That makes a very, very big difference in diagnosing what the problem is. So you have all these issues going in there, and of course we have things like ovarian cancer, which is a very, very, very deadly form of cancer. Not the most common kinds of cancer, breast cancer, prostate cancer, colon cancer, lung cancer, a lot more common than ovarian cancer. But ovarian cancer is the kind of cancer that you want to diagnose very, very early. So when you have stuff going on in there that is unclear, you know, it could be something simple like fibroids that's causing excessive periods and bleeding. But we want to be able to get to the doctor, get an ultrasound and do that, and hopefully a pelvic examination as well. So you have all these things going on in the belly, but probably the most lethal one is the appendicitis. Now the appendicitis is a little worm-like organ at the side of the right colon that you can live with without any problems. And so a lot of times patients are in perfect health and they begin to have the stomach pain, which might be kind of generalized at first, but quickly over time, over about the space of 6 hours, like you could go to work in the morning, all fine, and by afternoon, you're ending up in the hospital because you have appendicitis. So it progresses, in most cases, very quickly. The patient will say things like, every time the car goes into a pothole, I feel it. I feel it. And as you know, we have 1 or 2 potholes in Dominica, and so it's almost invariably the patient is going to complain about that. We ask about certain symptoms, what we call gastrointestinal symptoms, such as nausea, vomiting, diarrhea, constipation. Those are the 4 main ones, okay? And with appendicitis, the patient may not have diarrhea or vomiting, but they might be nauseous. But the first thing that happens is pain. Pain that comes literally out of nowhere. And I'll tell you 2 stories about that, which you may find interesting. One was when I was in the United States. I'm going to come right back to this after this message.
Sweet talk, dear man, have a lot of that. Yes, I. You don't know it's your boy Trilogy, urging everybody, young and old, to stay strong and stay healthy. You don't know we're doing it for 2018. Boom.
Today my rise like the sunrise, my bright and my upright, no one can broke my vibe.
I love listening to Strong and Healthy with Dr. Sam. I really learn a lot.
Yes, I had this patient in the United States. I was covering at a small hospital, and a 16-year-old white girl, Caucasian female, if you will, came in with right lower quadrant pain, And when I came to examine her, she held my hand. That's what we call guarding. It's hurting so much you don't want anybody to touch you. And the blood test shows her white blood cell count infection level was moderately elevated, right in that range for appendicitis. So I made the diagnosis, and I told the family that she needs to go into the operating room right away. I was probably around 34 years old, and the father was about the same age. And he came in front of me, blocking me like this, and he said, you, and he put his hand on my chest. He said, you are not going to operate on my daughter. I said, okay. I really didn't say okay, but in my mind, I thought okay. But I told him, well, I'm the only doctor in town. So if you want to move your daughter against medical advice, you can do that, because I am not going to allow her to die in this hospital while I am the surgeon here. And he went back, and the wife and the family and so forth began to talk to him, plead with him to do the operation. I went to the nursing station, I wrote my note that the patient was refusing surgery, and I called the chief nurse to witness and to sign it. About that time, he came back and he said, okay, go ahead and operate, but I'm warning you. So I went ahead, operate, they removed the appendix. Patient did very well, discharged home in 2 days. Usually the average is about 3 days. And afterwards he came to me and, kind of like his tail between his legs, but I'm a very gracious guy, and he bowed his head and he says, I'm sorry. And the guy started to cry, and he just came on me, and there I am standing, and this white guy is on me sobbing, He said, thank you for taking such good care of my daughter. And I kind of clapped his back and I said, it's okay, that's fine. But appendicitis is a very serious case. There's a case here in Dominica. I wrote about it in Dominica News Online. I don't want to belay the time. It's called, Do Some People Die Before Their Time? Very interesting case. One of the signs I'll just say in closing is that as the patient comes in, one of the things we do besides examining them and taking a very good history, I ask the patients to stand on their tippy toes like this and just let yourself drop really hard, drop like a sack of potatoes. And it's always dramatic. I really don't know of any other doctor who does that. I'm sure there are, but it's not something that I learned in medical school. It's something that I learned just in taking care of patients with appendicitis. And if somebody has any other problem, it's not a big deal. But if they have appendicitis, they go like this. And that is a classic diagnosis for appendicitis. So if you have a virgin abdomen, you want to keep it that way. But in life things happen, and sometimes a surgeon might have to go in there and do what is right for you. We've got to love ourselves, and I hope you had a very good Valentine's, and we've got to love our bodies. We've got to be aware. Look up websites like WebMD, not to diagnose and to treat yourself, but at least to educate yourself of the kinds of symptoms and to be able to have a more intelligent conversation with your nurse or a doctor. I want to thank you for joining us for Strong and Healthy. Strong. Let's stay strong. We've got a country to build, we've got to take care of ourselves, and we've got to work together to get things done. Thank you.
Sweet talk. Dear man, have a lot of that. Yes, I. You don't know, it's your boy Trilogy, urging everybody, young and old, to stay strong and stay healthy. You don't know we're doing it for 2018. Boom.